Video is going to be about a really famous small intestinal nematode from our examination point of view, that is Strongyloides, also known as Strongyloides stercularis. In this video we will try to understand life cycle of this worm, along with which we will also discuss the classical sign and symptoms seen with Strongyloides infection, also some severity of the Strongyloides, how do we diagnose this condition, and what we can do to treat and prevent this condition. So let's try to understand first where this worm resides in the life cycle of it. So since it is a small intestinal nematode, it resides in the duodenum and the jejunum, and it resides in the submucosa of the small intestine. Now note how where we have very special adult female in case of Strongyloides. Why it is special? Because it shows ovoviviparity. Also the term we use is parthenogenesis. This was a PYQ again. So this worm is ovoviviparous, means this worm is going to lay eggs, and these eggs are going to hatch within the worm itself into a rhabditiform larva, and this is why it is known as ovoviviparous. Now some classical things about this worm is that it has anal opening in the caudal end, which is ventrally, and caudal end is pointed. In the middle third to posterior third of this worm we have the vulval opening. These 2 points we must note. And another thing is why we don't have adult male mostly in the cases of we don't get infected with a adult male worm. The reason is it has no spicule for attachment to our mucosa of the small intestine. Also to identify it, you may note it is shorter and broader. So this was about the worm and how it resides. Now we know that adult female is going to lay eggs. Okay, these are the eggs which are going to lay into the larva very rapidly. Means they are going to lay larva within. They will quickly hatch into the larva, and these two are really special images from our examination point of view of rhabditiform larva, which are again and again asked. These two images are of stool where we see rhabditiform larva and some fecal matter. Okay, so now next what we have is we actually have now the rhabditiform larva in the stools, and this rhabditiform larva has now two fates, and this is important again. The first thing is that rhabditiform larva that passes in the stool has two types of transmission, either a direct development transmission or an indirect development. Next thing we need to know, which is really special about this worm, is that the rhabditiform larva while passing through our stool also changes into filariform larva, and this filariform larva you see in this image is going to penetrate the perianal and the perineal skin while passing in the stool and going to set a cycle of autoinfection. And this is again a very important question from Strongyloides, that it causes autoinfection. Not only Strongyloides, we have Cryptosporidium, Echinana, Enterobius, the Strongyloides itself, and the Tinea. These are known to cause autoinfection and are important PYQs in our exam. Next thing we need to understand, we now understood a small cycle that is of autoinfection. We also need to understand what happens when the rhabditiform larva passes in the stool. Now this rhabditiform larva either can undergo direct development, that is our soil has lot of now filariform larva. Means stool while passing, rhabditiform larva changed into filariform larva within the soil. This filariform larva has penetrating capacity to our skin, and it is going to penetrate our skin and is going to enter our body. Okay, the next development you must know is that indirect. By meaning we mean to say by indirect that we have a free living adult worm. In this case we have a specific female and a male in this case, and these are going to, female is going to again lay eggs, and these eggs are going to now form rhabditiform larva. Note in an indirect cycle we have the rhabditiform larva as well as egg outside of the body of the human, whereas in direct we had the egg inside of the body where the worm was situated. This is the difference. The next thing is that this filariform larva, after penetrating the skin, enters our venous circulation, and through our venous circulation it is going to reach the right side of the heart obviously, as well as it reaches the pulmonary circulation. Now we have to complete the cycle and anyhow reach the GIT, and that's not really difficult for the worm now. now, because it is in the pulmonary circulation, and through this pulmonary circulation you see the filariform larva reaches into the alveoli. And we know that from the alveoli it can reach up to our bronchus and trachea, and we frequently get our sputum from the trachea as a backflow, and this sputum reaches the pharynx, and from pharynx we swallow the sputums at times, and from the pharynx, when we swallow, it reaches into the small intestine, its place to live. This is the life cycle of Strongyloides that we all must know, because there are a lot of questions in midway in this cycle. So this is one of the cycle that we must remember in the parasitology. So next thing we will try to understand, we will try to understand the sign and symptoms related to Strongyloides. So the first point, where this filariform larva was penetrating the skin of us, leads to symptom related to our skin. That will be, we will have dermatitis as it penetrates. At the site we will have erythema and itching. Now very special condition associated with this Strongyloides is larva currents. Larva currents is a parasitic dermatitis that is because of intradermal migration of this form. You see this is appearance of larva currents. Now difference from cutaneous larva migrants, one special is it is really very fast spreading rather than our cutaneous larva migrants. The next symptom we need to understand is when this worm actually reaches a circulation to pulmonary circulation, because in the pulmonary circulation we have the worm, it leads to alveolar hemorrhages and bronchopneumonia. Also we may have sign and symptoms of asthma and bronchitis in this case. Now that we have skin symptoms and the pulmonary symptom, the worm can also cause intestinal symptom. The intestinal symptom occurs when we swallow sputum and the adult form resides in the duodenum, and this leads to intermittent abdominal pain, diarrhea alternating with constipation. You may note a patient presenting with peptic ulcer disease or malabsorption syndrome. So we had three specific presentation in this case, either of skin, a pulmonary manifestation leading to alveolar hemorrhages, bronchopneumonia, and intestinal manifestation. Now there is really one more special thing about Strongyloides, and that is when we have an immunocompromised host, like one with a cellular immune defect or HIV. In this case we are going to have an extensive internal reinfection. When this intensive internal reinfection sets in, we have really very debilitating condition and disseminated infection leading to brain abscesses, meningitis and peritonitis. So this was about the life cycle symptomology of the Strongyloides. We also need to diagnose this condition, and that is mostly by the microscopy, where we are going to see this rhabditiform larva in the stool. And finding this rhabditiform larva in the stool is most important in specific method of diagnosis in case of Strongyloides. Note, eggs are unhatched in cases, if the eggs are unhatched in cases of stool, we may confuse this condition with hookworm, which is rare. We mostly see a rhabditiform larva in case of Strongyloides. Now two methods which can increase the diagnostic yield by increasing the sensitivity are formol ether concentration and Baerman method. These may be MCQ in your exam. The next thing is, how do we culture it? If we have scanty larva, actually we culture it in charcoal culture method, and we get a high yield after 7 to 10 days. Serology, as we know, the common test we do, CFT complement fixation test, immune hemoagglutination assay, and ELISA. Eosinophilia, as we know, is a feature of every parasitic infection. So this is how we diagnose Strongyloides. Next, the treatment of choice in case of Strongyloides is ivermectin. Along with it, ivermectin is also drug of choice for onchocerca. You also need to remember small intestinal nematode. Most of them are to be managed with albendazole again, but this is one of the rare case scenario among the few that where ivermectin is the drug of choice. Prevention is the better than cure, as we know. We need to avoid the soil that is contaminated. We need to have a proper human disposal so that the soil is not contaminated again, and we need to treat the patient again to decrease the contamination of soil and prevent the transmission of the disease. So this was bits about Strongyloides. Hope you liked it. Thanks for watching.